Hello and welcome to Vital Line Nurses. Today, we are diving into an important ECG topic, atrioventricular block, or AV block. AV block is a type of heart conduction abnormality where the signal between the atria and ventricles is delayed or completely blocked. It's categorized into three main types: first-degree block, where the impulse is simply delayed; second-degree block, where some impulses fail to reach the ventricles; third-degree or complete block, where no impulses pass through at all. Understanding AV blocks is crucial for nurses and healthcare professionals to identify cardiac emergencies early. So, let's break it down, type by type, with clear ECG examples. Let's get started. First-degree AV block is the mildest form of heart block. In this condition, the electrical signal from the atria to the ventricles is delayed, but not blocked. This delay shows up on the ECG as a prolonged PR interval, more than 0.20 seconds, but every P wave is still followed by a QRS complex. It's often asymptomatic and found incidentally, but may indicate underlying heart disease or medication effects. Regular monitoring is important, even if no treatment is needed. Second-degree AV block type 1, also called Mobitz type 1 or Wenckebach, is a condition where some heartbeats are dropped. The PR interval gradually lengthens with each beat until a QRS complex is suddenly dropped. This creates a repeating cycle on the ECG. It's usually benign and may not need treatment, especially if the patient has no symptoms. However, close monitoring is important to rule out progression to a more serious. Second-degree AV block type 2, also called Mobitz type 2, is more serious than type 1. In this condition, the PR interval stays constant, but suddenly, a QRS complex is dropped, meaning some heartbeats don't reach the ventricles. This shows up on ECG as regular P waves with missing QRS complexes. It often signals a problem in the His-Purkinje system and can progress to complete heart block. Immediate medical evaluation and often a pacemaker are needed. Third-degree AV block, also called complete heart block, is the most severe form of AV block. In this condition, no electrical signals pass from the atria to the ventricles. The atria and ventricles beat independently, each with its own rhythm. On ECG, you'll see P waves and QRS complexes, but they have no relationship to each other. This is a medical emergency that often requires an immediate pacemaker to maintain a safe heart rate. In complete heart block, there is complete absence of AV conduction, with none of the supraventricular impulses conducted to the ventricles. The perfusing rhythm is maintained by junctional or ventricular escape rhythm. Alternatively, the patient may suffer ventricular standstill leading to syncope or sudden cardiac death, if prolonged. Use this breakdown as a quick and effective way to reinforce your understanding of AV block classification. To stay updated with more clinical tips and simplified explanations, make sure to like, share, and subscribe, and turn on notifications by clicking the bell icon.